Welcome to the Eye on Annapolis Local Business Spotlight. There are thousands of locally owned businesses in the area, some small and some large. Some you may know and others you don't. But one thing they all have in common is a great story, and we want to share it with you. Join us every Saturday as we talk to the founders, the owners, and the managers of local businesses you have come to know and love, and those you will come to know and love. Now here's your host, John Frenay, with this week's Local Business Spotlight.
Well, this afternoon we are sitting down with Dr. Mark Baganz, who is the founder, medical director, and probably have a couple other different titles to go with this, but with Chesapeake Medical Imaging. How are you today?
I'm fine. Thank you. It's really nice to be here.
It's nice to meet you. And did I get all your titles correct?
Yeah, there's always those other ones you add on there when you're the head of a small company, which is, the bottle washer and the floor sweeper.
Okay.
But essentially, yes, the founder and kind of medical director are kind of the best titles to use.
Well, we're right here at 122 Defense Highway, which is, and I hate to use Best Buy as the reference, but it's a little bit up from Best Buy on the right-hand side.
And Home Depot.
And Home Depot. And one of my favorites is Sonny's Deli, which is right on the corner of the building. But first of all, you're celebrating a birthday this year. You are 20 years old, not you, but your business is 20 years. You founded this in 2001?
Right. And in July of 2001 is when we opened our doors as a single outpatient radiology center here in Annapolis. And it was it was a lifetime ago. And
you still have your hair. It's awesome.
Yeah. And it's the real thing. Maybe not quite as thick and lush as it used to be, though.
True. But so what is your background? How did you come to Annapolis and get into medical imaging here?
Well, I moved to the Annapolis area when I was in training doing a radiology fellowship in a part of radiology called neuroradiology, which is really kind of brain and central nervous system and spine imaging. And I did a postgraduate work at University of Maryland, Baltimore, and moved to the Annapolis area then and just never left. But after training, I started working in Washington, D.C. at Howard University and was on the faculty there for a number of years, but didn't want to leave Annapolis and saw an opportunity to hang out my shingle, so to speak, here in Annapolis and open a radiology facility here.
Now, you are a radiologist. Are radiologists automatically, is that a medical doctor? Okay.
That is correct.
I will warn you that as we discuss, my ignorance is going to come flowing right out here.
That's fine. There are two kinds of radiologists traditionally, but the word radiologist now has become synonymous with somebody who's a diagnostic radiologist, and that's a medical doctor who then did a subspecialty residency in diagnostic radiology. The other side of radiology is what they call now radiation oncology, and they're the people who use radiation machines to treat cancers. But that's not the type of radiology we do.
Okay.
Or diagnostic imaging is what we do.
Okay, so in a pinch, you could give me some stitches if I cut my arm.
Could do that, and it's been a number of years since I have, but might do a good job even. I always like suturing up wounds.
Well, so 20 years ago, though, Annapolis was rife for a radiology. I mean, I know we are sort of a hub of the medical community for certainly Anne Arundel County and the region. We've got AAMC that's, the large campus that moved up they moved here shortly before you started this to their new campus.
Just as a women's hospital, just as OP, they were still downtown when we opened, I believe.
Okay.
The main hospital was. But it was all about the same time, though. The women's hospital where they're doing the baby deliveries was actually on that campus. But it was a slow transition. But about the same time, the downtown hospital had closed and they moved out here. And Annapolis wasn't necessarily open for new business to come into town. We had to earn it. It was there were two very solid, respectable, great radiology practices in town. The group that was at the hospital, and then there was a group that had been bought by a company called American Radiology. So there were two. There was radiology service in Annapolis, and our role was filling in the gaps where we saw an opportunity, a need that wasn't being met. And so that's where we kind of had to find that, thread that needle and find the success and deliver something that we think was maybe not getting delivered quite as well as it could be.
Okay, well, you mentioned that Chesapeake Medical Imaging is not the radiology oncology. So you're doing imaging, anything with
diagnostic medical imaging. And for instance, when we started that very first office we just had one machine. Radiology has a whole bunch of different machines. They call them modalities, but we had just MRI. That was the only thing we had. So when we opened, we were an MRI only radiology practice. And that was part of our niche.
Okay, well, what are you? What types of images are available through CMI?
Well, now we are really full-service radiology, and this will let you understand what radiology does now. So we still do MRI, and that's still our focus, and we do a lot of MRI, and we do more of that than anything else. But we also do a lot of CAT scans. We do a lot of PET scans.
What's the difference?
Well, a PET scan is typically for cancer imaging. It can find cancers and identify where a cancer might be in the body if it's hiding someplace, whereas a CAT scan is less cancer-specific and more broad-based for looking inside the body.
For like a tumor or something along those lines?
Tumors and appendicitis and lung nodules and heart disease and fractures. And ultrasound is another thing that we're very busy with.
I've got 3 kids. I know what they are.
Yeah. And regular old X-ray, this standard old way that radiology started in 1893 with a guy named Wilhelm Röntgen. His first thing, that was the beginning of radiology 130 years ago. And so we still do regular X-rays, just not as much as they used to be used.
To be honest with you, I have never been a patient here, although I have driven 3 people here. Mm-hmm. And I know every time I've been here, the parking lot has been jammed, which is a good thing for you. That's always a good sign. But how do you work? I mean, are you all just referrals? Is that what pretty much a doctor just refers you?
That is what it is. We are at the beck and call of the referring physicians in the community. They need help figuring out a problem with one of their patients. They want to have a diagnosis either confirmed or they suspect something's wrong. They're not really sure what it's going to be. They send them to us and say, can you help us figure out what's going on? This person has abdominal pain. We don't know if it's just an upset stomach or is it an ulcer or is it a tumor of the pancreas? Is it a cancer of the colon? Is it something else? Can you help us figure this out? So they'll come to us and we'll provide that service and hopefully work with the referring doctors and provide them answers so the patients can get treatment.
So then it is a team effort. I mean, I guess prior to really having that ability to refer to a radiologist or something like that, they're going in and they may not even do this anymore, but I guess would be exploratory surgery.
Radiology does help remove the need for exploratory surgery. That was one of the benefits of the CAT scan revolution, which has really been around for going on 50 years now, but that was the ability to see in the abdomen and find things without actually having to go in there and look.
Well, non-invasive is the way to go. I mean, I know with the way that they can do with the arthroscopic surgeries and the cameras and everything else is pretty amazing what they have anymore. How did you personally get into radiology? What turned you on as you were going through medical school into that as opposed to...
Well, that's everybody has their own story of how they followed their pathway in medicine. Mine was you have to decide what you're going to go into in medical school before you really know what it is. It's really second year in medical school when you're still in the lecture hall. You haven't really even been in the hospital seeing patients, but at least back when I was training, that's the way it was set up. You're supposed to start deciding what you want to do, and it was difficult. I knew that radiology, MRI was just coming around. I knew there were some really cool technologies that were just around the corner. And I talked with enough people that were mid-career saying, do you like what you're doing? What else would you like to have done? And if you could do it again, what would you do? And I asked that question of people that I respected.
Sure.
Internists and pediatricians and ophthalmologists and orthopedic surgeons and radiologists. And there was a general tendency for radiology to kind of like be elevated up on people, insiders' opinions about what they would do in medicine if they could do it again. There are enough people who said, I think radiology is the coolest thing and it's got the brightest future right now. And, those were non-radiologists sometimes said that. And so I said, okay, that's enough of a gamble. If you have enough mentors and people you respect who really know medicine much more than you do could say, so I kind of put my eggs in that basket and said, I'm going to give it a try. And applied for a residency in radiology and a graduation of medical school. And, that was the end of it. And I've been really happy with that decision.
Well done.
In hindsight, feel somewhat lucky because I made that decision.
No, absolutely. I mean, there's got to be nothing worse than working in a career that you get down up in the morning and you slug yourself down the stairs and, got to go to work again. So, I mean, it sounds like you're loving it.
Right.
Which is great. Well, you mentioned the technology that was coming up and everything else when you were going through medical school, and you've been around for 20 years as a practice here in Annapolis. What technology has changed? I mean, has it really just gone nuts? Because I talk about older people. I mean, I've got some, my parents are just recently passed away, but I said, what they have witnessed in their lifetime,
right?
From the start of the cars to the industrial, just all the way through telephones that weren't party lines to cell phones to computers to
right. It's been a revolution. I think radiology has really, really changed. I graduated medical school in 1988, which that's really a couple lifetimes ago. And in that year, there was one MRI scanner in the city of Washington, D.C., where I was in medical school. There was another one at NIH and another one someplace else in kind of the suburban Maryland area. So there were 3 of them in the whole Washington area. Now there are going to be 300. So it was at the birth of the MRI revolution. And so I got to experience that. MRI went from something that was really unheard of for clinical use. Sometimes it'd be a special test you could get for somebody suspected of a brain tumor, but really nobody was. It was unheard of for the most part back when I graduated from medical school, and it rapidly changed. Within 5 years, it was seen as such a valuable tool. No radiation, no ionizing radiation, no x-rays, but is able to look inside the brain, look inside the abdomen, look inside the spine, and give exquisite information. And so all of a sudden, MRI is where I kind of put my focus in my career to begin with, and really loved that as a technology.
I'm pretty sure I tore my quadricep tendon, and I had an MRI at the hospital, I believe. I fell asleep during it. I don't know whether I'm unusual or not, but I know it was making a lot of noise, and my girlfriend was like, "You fell asleep?" I said, "Yeah, it was like a 20-minute nap. It was great."
Right.
Just sort of
not unusual. That certainly happens. The other side of the spectrum is people
freak out.
They are uncomfortable in that space, and that's a problem sometimes.
Oh, I'm sure. Well, that looks like you're jamming you through the little donut, donut hole, and rotating it around you there. But that's you are not just here at 122 Defense Highway. You have since 2001 expanded. And you've got 13 different locations across. I would say the county, but you've got a lot in Anne Arundel County. But you're out on the Eastern Shore as well.
Right. So we've got 4 offices in Anne Arundel County. We've got 3 on the Eastern Shore. We're in Easton, we're in Chestertown, and we're on Kent Island. And then we're also up in the Baltimore Beltway area. We're in Catonsville, and we're in the Towson-Lutherville area. We're at White Marsh, and then we're in PG County. So we've been fortunate that our version of radiology, the way we kind of have designed our delivery system, has been popular, and we've been able to deliver that to patients in kind of an ever expanding kind of sphere we've been well received, and it's something we're thankful for, but we also kind of think it's maybe a good sign of the way medicine's heading too, because what we think we deliver a little differently is a little more personal service, a little more kindness, and maybe even a little more love that comes through our interactions with patients. And
I was going to ask you that. I mean, it seems like this practice could be very prone to just a line. In, take your picture out. In, take your picture out. We'll send it to your doctor. And that's not how you operate?
That's not how we operate. We radiology used to be a thing where the radiologists and the patients rarely interacted unless there was actually a procedure that required hands-on touch. We have had a more personal approach to our patient contact, and radiology during my career has become a more patient-centered specialty where there's more patient contact. Patients want to have more input into their diagnostic workup, so they're happy to have the interaction with radiologists. But I think the real thing is our technologists, the people who run the machine. They're the radiology techs, the radiology technologists, our front desk people, our assistants that are helping the process. Their kindness, we've been so fortunate that have a team of people that are really, really committed to what they do, but also are able to show that warmth. And I think that's what's really helped us, is that hiring people who show that sense of love in a very palpable way and know that people are uncomfortable if they're uncomfortable, can sense that, can move them through the system in a way that people know that they're the focal point.
People, let's face it, people come to see you under a stressful situation. I mean, something is wrong.
Right.
I mean, I'm not perfectly healthy. I just finished that marathon and I'm great. I'm not running down here to see you because everything is great. It's when I feel a problem or when my doctor sees a problem, something like that. And that's just, that speaks volumes to your practice to be able to sit there and say, well, and I did see that when I checked in, and I say checked in, but when I arrived here, at your front desk, they were like, you could see how they were interacting with the folks in the waiting room. You could see how they interacted with me, saying, oh yeah, just a minute. And then they politely said, you're in the wrong place. Go across the parking lot. And but it was.
I think that's astute, and that's right. And that what you just characterized something really well, and I think that's what we've tried to encapsulate that and use that as our kind of teaching point. When people are coming through the front door of our office, it's because something's wrong. Some of them, it just might be they twisted their ankle and they know that something's wrong with that, and it's either broken or torn or something. But other people have bigger concerns. It might be, do I have cancer or not? And so they're coming in with trepidation and fear that this could be what we say, the first day, the rest of your life, like the day that changes everything. And we have to realize that is a really human event. That's a life event that they may be going through. And for us, it's just another day at work. But for them, it might be maybe one of the most important days in their life.
Now, when you get referrals from doctors and then the empathy that your practice shows and everything else, can you pick and choose the doctors you work with?
No.
They're coming with a referral, and I'm sure insurance dictates to a large degree what goes on. But it's I know there are some doctors that have that proverbial bedside manner that's just absolutely horrible.
Right.
And then there's others that are like, oh my gosh, this is. We need to call and follow up, and I'm going to spend time with you and answer your questions, and everything else has a different type of a thing. So I just didn't know whether there were some doctors that, that you could sort of pick and choose, or
don't know how to answer that. There are certainly doctors who are more prone to send to us than to the other radiology facilities, and one of the reasons they may choose that is because they know there might be a more personal experience.
That's fair.
But really, the pick and choose isn't what we get to do. It's they decide that, and sometimes it's really just we have niches of specialization where we actually do things that we really focus on. That maybe that's as much as we get referrals because we're particularly good at a few different things that we stand out with.
Now, I did notice that you have 3 offices here in Annapolis. You've got Parole area, which I guess this is where we are right now, Bestgate Road, and then West Annapolis, right?
Correct. That's correct.
Are they all the same?
They aren't. The one where we are in Defense Highway Parole area is really our full-service busiest office. And the other offices we've opened really as satellites because of need for overflow. We are landlocked in our current office, and there's demand for services that we can't provide quickly enough here at the main office, and so therefore we've had to add extra capacity, and we haven't been able to do it at the main office, so we would look for other places close by. For instance, the Bestgate office is it's a place we're adding PET CT is what it is as the main part of what we're doing, which is the cancer imaging tool,
Right.
but it also is neurology imaging, Alzheimer's imaging, and some other things that PET scans do really well. We don't have that in the main Annapolis office, but we need it, and so that's why we opened that office there.
Okay. So you've got some different technology in the different offices to accommodate what
That's
you're at. I know out on the Bestgate Road they've got the Maryland Oncology Hematology that's out in that area. They've got an office.
Correct, and so they'll be a heavy utilizer of the PET CT services.
It probably makes sense. Yeah, go downstairs or go down the road and figure it out for here. What is the future for CMI? Are you looking to more expansion, or are you looking to pull your hair out some more, thin the hair?
Good question, and I think it's more of the same. Do what we do as well as we can. Our expansion's always been very organic, and as you can see, we've added maybe every year, maybe open an office or so, kind of historically throughout our history. We have 12 or 13 offices in 20 years. That's kind of been our growth rate. And we're still maybe on that rate, possibly. And when we open a new office, it's always been in a shoulder community, a place where we have a reputation, where people want us there, where people say, "Can you open a spot?"
It's the best place to do it
in this community. Your reputation precedes you. We know you're going to be successful, and so please come and open an office here. So we've always done that, and it's been in adjacent zip codes, couple zip codes over, and that's really so we don't have to go into a new community and start from scratch. We go because people are asking us to come because they say,
Who's this sketchy Dr. Baganz guy that's coming in and doing this? And you know exactly what you're getting. That's fantastic.
Right. And the first office was the hardest to open, maybe, the Annapolis one, because we were an unknown quantity. We had to prove ourselves. And 20 years ago, and we did the hard work then. And then once the reputation is built as a place that's offers something special, it's easier to have that second and the third office and the fourth office. And it has kind of successes, stood on the shoulders of past success.
So we're looking for potential expansion if it makes sense. And obviously you're still young and active and involved in this thing, but as it goes down, do you have children that are looking to get into the field? Or are you, with this?
Lucky to have two wonderful kids that are kind of, college age and immediately post-college age. And neither one has said that they're looking to go into the medical field. When I was their age, I didn't know what I was doing necessarily either.
Obviously, you are not the only doctor here. I mean, you've got a whole cadre of doctors that are
right. So we do with that, and that's what makes it okay. We've got a team of like 15 of what I think are the best radiologists that I've had a chance to work with at any place, and we're lucky to have them under our roof. And it allows me to kind of help be a member of a great team as opposed to have to do it all, and that's wonderful. And then the administrative staff, the management staff, the executive team is the dedication of that group is so phenomenal, and that makes it easy and it makes it fun, and it means that I'm in no rush to do anything other than just keep doing what we're doing and do it as well as we can.
Come into work every morning with a smile on your face.
Yeah.
What's the worst part about owning your own business, especially one of this size?
Well, I think when you say you come into work every morning, you actually don't do that because you're already at work when you're waking up in the morning. You're already at work when you're going to bed at night, and there probably is no real downtime. And same thing with time off. If you're on vacation someplace, you're still at work. That's probably the beauty and the curse of small business and being a business owner. And we've got couple hundred employees, 175 employees, maybe post-COVID. It's a smaller workforce. Luckily, we've been able to keep really everybody who wanted to keep working. We were really fortunate to be able to do that. And realizing that all those people have families and the success of the business is the success of the practice. It's not just taking care of patients, which is our fundamental main purpose, but the ancillary thing is taking care of all those employees and all their families, and they all depend on their job, and they all depend on their mortgage payment,
they
their
need
car payments.
dinner on the table tonight.
And so that's the other thing. And if you think about it too much, it could drive you crazy, but you have to try to just take it in stride.
True. How did the medical industry work throughout COVID? I mean, obviously, I know the hospitals sort of pulled back on visitation and stuff like that, and you've heard all the stories about people going, "Ooh, elective, no, that torn ACL, I think I'll just limp around for another."
And that completely happened. I mean, all the orthopedic surgeries, so a big part of our business is the things like the torn ACLs or the slip discs, the herniated discs in the back, and the rotator cuff tears. Those guys, doctors who take care of those problems, they just stopped taking care of those problems because of the state of emergency. Is all of anything non-COVID related, really, if it wasn't truly a life-threatening emergency, got shut down at the hospitals. So that meant there was no need to do radiology to look at that torn ACL.
Because there was no surgery happening.
And so we all, and I think it was universal, that over half of our patient flow for not just radiology, but all the practices got cut. So we were, went down to less than half of our normal kind of business. And that was always a challenge. We knew there's light at the end of the tunnel. We just didn't know how long that tunnel was going to be. So
I did notice that it was funny when I walked in the front door. I'm vaccinated and I'm starting to feel a little bit confident myself. Mm-hmm. And I walked in the front door and everybody in the waiting room had their masks on and behind the desk. And I went and I did like the Dorothy thing, saying, "Oh, we're not in Kansas anymore." Went back out to my car, got my mask, and came back in. Is that a policy of the practice
and it's a slow change. And I think healthcare is going to maybe be the last adopter of kind of the open, voluntary, maskless approach. Our governor has a change in policy that's going to open things up, and I think medical offices are still probably going to be slower to become mask optional. But that's certainly, we see it happening in the probably not too distant future, where maybe it's an honor system. If you're vaccinated, you don't wear a mask. Maybe that's the first step.
Right.
But we still kind of, there's an expectation of a certain number of our patients who want to feel safe and know that we are taking safety kind of maybe more seriously than anybody else. It gives comfort, even though there's another subset who maybe get a little frustrated because they're like, "I'm done with masks. I don't want to wear." So
I think we're all done. We're all done with masks. But
it's walking a fine line, and we're not going to be jumping the front of getting rid of the mask, but we're probably, it's just around the corner for everybody.
And I'll say from my misguided perspective too. I mean, I'm coming into a medical office. I'm like, well, everybody here is sick, regardless. I mean, that broken arm does not do anything.
We certainly get a share of people that are coming in because they have an acute illness that they don't know what it is, whether it's abdominal or chest, right, or and there's COVID's still out there. Luckily. Yeah. Not at the level it was, but it hasn't gone away.
Knocking on wood on that one, that's for sure. Dr. Baganz, thank you very much, and congratulations for 20 years of Chesapeake Medical Imaging. Again, it's at 122 Defense Highway is the main office. Their website actually has gotten a lot of information. It's CMIRAD, which is Chesapeake Medical Imaging, radiation, I guess.
Radiology.
Radiology.net. And
right,
it's
NET.
CMIRAD.net. And lots of information there. And if you're ever in the need of a good practice that cares, it's not just a person passing through a machine that makes bumps and grinds and spits you out the other end with a piece of film.
Right.
This is probably the place that you want to go to, one of their many offices. And I appreciate your time today. And again, congratulations on 20 years. That's just absolutely wonderful here in Annapolis. And I appreciate that you are locally owned. I appreciate your small business, and I certainly appreciate your time today.
Great. Well, it was wonderful having the conversation.
Thanks for listening to this week's Local Business Spotlight. Please make sure to visit eyeonannapolis.net for all your local news, events, and opinion. And in case you haven't already, please subscribe to the Eye on Annapolis Daily News Brief, where we bring you all the day's local news direct to your phone, tablet, or computer in about 10 minutes. It comes to you at 6 a.m. every Monday through Friday, and you can subscribe on Apple Podcasts, Google Podcasts, or wherever you get your podcasts.